Good morning. Welcome to GBMC's Facebook Live. Michael J. from iHeartRadio and 93.1 WPOC. I'm thrilled to be able to do this again. It's so much fun to visit with the various doctors with GBMC. And today, we're going to visit again with Dr. Robin Motter-Mast, who is the Medical Director of Primary Care with GBMC. And we're talking about the opioid epidemic. We're going to talk about how pain affects all of us and how we should properly deal with it. So, doctor, let's talk about, to start off with, pain itself and how do we know as patients?
You could use some over-the-counter medications like Tylenol or Motrin, depending on what other medications or what other medical problems you might have. But if they continue to persist over a period of time, I think everybody wants to know, why am I having this pain and what else can I do about it? So if you're having persistent pain, that's another great time to go to see your primary care physician and try to get an answer about what exactly is going on and triggering this and what else can I do to try to stop it.
Right. I've been through some surgeries myself, and I know in those surgeries they use very strong narcotics to get you through the surgery. Morphine or propofol, which Michael Jackson died from. Those medications are prescribed in the hospital to be used in specific situations where doctors are administering them. And I've heard of stories, and I think we can talk about this a little bit, about how perhaps doctors have allowed the prescription of drugs for pain to maybe escalate too high, and it's caused addiction.
Mm-hmm. Yeah, unfortunately, I think there was a period of time in the last 10 years where pain was really, we would call it the fifth vital sign. So what that means is most of you probably have gone to your physician and they ask you, are you having any pain today? And if you say yes, they ask you what your level is. So there was a period of time when we wanted to make sure that everybody was asked about their pain. It was unacceptable really to have any pain at all. We wanted everyone to have a 0. And if you said anything other than a 0, then we were in the medical profession trying to do something to remedy that for you. And what happened was we started using a lot of narcotics to treat people for this pain to get them down to their 0. And pharma had a lot to do with us. As drug reps would come through the physician's offices, they would often talk about people shouldn't be having people to be pain-free all the time. And what that did for patients was upregulated their cells that they had with the pharmacological drugs that we were using. And so the body started actually requiring these medications to kind of function. So what we did was really create some drug addicts or drug-like behavior, addictive behavior in people like your grandmother who maybe just had a knee replacement. And we said, we don't want grandma to have pain, so we're going to just around the clock, 24/7, give her these medications. And now what happened quickly then thereafter was people's bodies started to require these medications. So as soon as grandma's pain really should have been better, and a week or two after her knee replacement, now all of a sudden she is feeling the need to have these pain medications just to feel normal. Because if she didn't have them, she would actually start to go through withdrawal symptoms.
Wow. Well, we all deal with pain, and I want to invite you to share any questions you might have. We have got questions coming in now, or no? Nothing yet. If you have any questions, feel free to post them regarding pain when it's appropriate to addicts. Are there other things that we can do to treat pain?
There are so many things we can do, and we're really living in this great time where we talk about different types of medical therapy that you can have that you didn't think of as traditional medical therapy. So there's acupuncture, and there's acupressure, chiropractic care, physical therapy, and just flat out exercise. So working on strengthening and conditioning of your own body, even at the gym or even in your own home doing exercises, are things that really help to limit the amount of pain that you can have. And it seems strange when you're talking about having my back really hurts and then somebody saying, well, you really need to do some stretches and exercise. Some people think that that's going to make my back hurt more. But what you really want to do is help your body to support itself and support the joints. I mean, osteoarthritis is one of the biggest reasons why people have pain. Pick a joint. Knees are most common, back probably next. And doing those things to strengthen your body can really help. So there's foods that you can eat. Certain foods most certainly are triggers for increased pain.
Like
Refined sugar is really not very good for your body. So eating, a lot of fruits and vegetables, things that have some great minerals, vitamins in them, iron, that are easy to digest and really just powerful micronutrients for your body is a great step. And there's supplements that are out there. Now you have to be a little leery of some of the supplements because some of these supplements are not FDA approved, but anytime you go onto Facebook or you go onto the internet at all, you can find a bunch of miracle drugs that are out there to help you not have any pain. But there are some things that are evidence-based. Glucosamine, chondroitin sulfate.
So you hear about glucosamine all the time. Does that work?
For some people it does work. And there definitely have been studies to support that it does work. So what I usually tell patients is try the supplement for a month. If you feel better afterwards, then it's worth it, depending on how much it costs. But if it doesn't help you at all, then it's just not worth your time. And you don't know what else is in a lot of these supplements because they're not FDA approved.
Right.
So you don't know what else they're combined with. But if you go back to eating, 5 servings of fruits and vegetables a day, you're off to a really great start.
Water is probably a good thing to be doing to stay hydrated. A number of questions that we had prior to coming on Facebook Live. And again, feel free to post your questions for Dr. Robin Motter-Mast. She's with the GBMC. She's the medical director of primary care. Why is overprescription a problem? And that's the initial question. I think that some people need other doctors and maybe it's part of the pain is in our minds. I know that if you're fearful, you can become more fearful thinking about the fear. It's a big circle that you get pulled into. So if you feel pain and your natural tendency is to become afraid of the pain, it can make it worse, right?
It really can. So there are a lot of tools out there now. We talk about our behavioral health integration program that we have at GBM, screening tests when patients come in. So we will ask you about your level of depression. If you seem like you're having some anxiety, like you just described, about I'm really worried about this pain, we may do an anxiety score. And then we're also screening all of our patients twice a year for substance use. And that substance use is not just about opiates. So we talk about how much alcohol are you drinking? Are you smoking cigarettes? Most people are addicted to their cigarettes, so there's something that we can do to help them to remove the cigarettes from their lives. And are they using any illegal drugs over the street drugs? And are they taking prescription pain medications that really weren't prescribed for them but for someone else? And if they say yes to those questions, then we have some tools now in the primary care setting to try to engage and help those patients. So if it's anxiety, we're going to support them with some use of tools to help them cope with their anxiety. And letting everybody know that it is okay to have some pain. So how much pain is it good to have and how much pain is it not good to have? And that's not something that's easy for someone who's not medically trained to always understand.
Right.
So that's why it's great if it persists or if it's significant that you get to your primary care and have them help you to decide what you should be doing about your pain.
If someone's watching this right now who is dealing with an addiction and they know that they're taking either street drugs or an excessive amount or more than they know they should be, and they are addicted, how do you get off? I mean, who do you talk to? Is that something that's easy to deal with, or is this something that's really difficult to deal with?
I would say it's difficult, maybe not really difficult, depending on how long and what you're taking. But your primary care is a great starting point, so they can help you to engage in those resources. As I mentioned before, we have somebody from Colmac comes in for alcohol and drug. We can see if your insurance, what type of insurance you have, what type of programs we can get you into.
Right.
So it might be a program for an intensive inpatient program that you really need to kind of de-escalate off your medications, or it might just be an outpatient program, or it could just be attending, an AA group and get you engaged in that and just having a little bit of support about how you can not drink as much and maybe giving you some medications to help deter you from drinking, like Antabuse. And then there are some providers who are prescribing Suboxone for those patients who are addicted to opiates. So we have some of those providers within GBMC. So coming to your primary care provider and having us help to guide you to get you where you need to go for the next step is something that we really want to do for our patients.
I think the first step I want to talk about real quick is trust, because You know, when you're a patient and you're dealing with all this in your head, and you know what you're burdened with, but you've got to trust your doctor that they're going to be able to be your confidant. I mean, from a legal standpoint, are you able for someone to come in and say, listen, I take street drugs? I mean, do they have to worry about legal implications? I heard this is off topic, but I heard a conversation earlier today about LGBTQ patients having apprehension to address those issues with their doctor. And it really, when you go into your doctor's office, you've got to be able to stand naked in front of the doctor and open up, I mean, to really get advice, I would think. I mean, as the medical field, you're prepared to deal with all of that.
We are prepared to deal with that, and that's something that we spent a lot of time thinking about. How do we protect the patient? Because going back to do no harm. So you know, as a patient, when you come in, sometimes you might be applying for life insurance, and your life insurance company is going to come to your primary care provider and ask for their notes. So if you have told us things in those notes then become accessible to the life insurance company. So we want to remove the barriers from people coming to their primary care physician and allowing us to fully treat you as a patient. Because if I don't know those things that you're dealing with, and I'm only looking at what your blood pressure is today,
right,
I really can't treat you adequately. So we take notes to make sure that the type of information that you would consider sensitive, we put in a sensitive note that really can't.
So that's confidential.
It's confidential, and it's only seen by certain members of the medical staff. So really providers, the people who are treating you who really need to know that information can see that information. We try to even protect it a little bit from people who are asking for records. So if they specifically come to me and they say, I need the mental health records, then by law, I'm going to have to turn those over. But generally, they don't do that. They just want their medical records. So we're able to protect that. I think one of the things that's scariest to me is when you work for an organization and your benefits are at that organization, and you have to get your care at that organization, so everyone knows your issues. So if you have mental health issues going on, that's a little scary to just bring that to the table and let everyone know. Or if you have substance abuse issues, that's even scary. You don't want to lose your job as a result of the things that you're coming and asking for help.
Right.
So we take that very seriously, and we're doing everything we can to protect your record. In fact, with substance abuse, there are laws out there that specifically carve that out. And we have that information within our system, not even in our system. It is protected under the substance use consultant. They have it out of the system, and we try to keep that private and protected for you.
I just think it's important for people who are sitting there watching this thinking, I'm taking these painkillers and I want to do something about it, but how does that affect my life?
I feel like you're handcuffed a little bit, yes.
Right, and so, I mean, does this start, you go in for a back surgery and you're prescribed or you're given morphine perhaps in the surgery, or propofol or whatever else, and then you're giving narcotics in the hospital to come off of that surgery. I mean, I've heard of people that are afraid to even take those just because they're worried about becoming an addict, taking these medications.
So that's the job of your healthcare provider, to really make sure that doesn't happen. And at the hospital, even with orthopedic surgeries and other surgeries, they're limiting the amount of prescriptions that they will give you. It's sometimes down to just 3 days worth of medication. And that is not enough to make you into an addict.
Okay.
So you can feel good about the fact that if you leave and you have a few days of prescriptions for pain medication, that is not going to make you into an addict.
Gotcha. Will is asking, opiates, opioids, and heroin, are they all the same thing? They offer similar effects. This has been an issue way before the pills. This needs attention on all levels because they're all intertwined.
Yeah, I think that's a great question. They are really, an opiate is an opiate, and it comes in different forms. Heroin is, of course, a horrible problem, and in Baltimore has a horrible heroin epidemic issue within the city. But the big issue we see is with the pills, and the biggest issue that really has been starting to surface is the fentanyl issue. And fentanyl is a drug that can be synthetically made that looks like an opiate, and has been causing a lot of fatalities. I had a patient come in the other day. I think almost every one of us sitting around here could think of a friend or a family member who has been touched by having a loved one or a friend die from overuse or overdose of the opiate prescriptions or fentanyl-like substance. I had a patient the other day who came in, and she said she had to bury her 19-year-old nephew who was at college along with a couple of his fraternity brothers because they were at a party and they were given a Xanax. And unfortunately, the Xanax had been mixed with some synthetic fentanyl, and that one pill became lethal, and they were overdosed. So, of course, I went home and told my children, whatever you do, don't touch any of those things. You never know what you're really going to be getting nowadays. But the fentanyl is a huge issue right now. It's responsible for a lot of death within the country.
And this is a street drug that your kids might be involved with that you might not even know about.
Fentanyl was a pain patch that was originally manufactured to help to treat pain.
Okay.
But they are using it and putting it in pills, and they're mixing it with other medications.
Wow. Just a real quick heads up for parents who are hearing about this for the first time. Fentanyl, is that what the kids call it? What kids are calling it, or is there another name for it?
I think that's what the kids call it.
Okay.
But I think the problem is that some of them don't even know what they're getting.
Right.
So they're getting it from some supplier that's putting something in it.
And it's a pill that you're taking, or?
It can be a pill that you're taking.
Okay.
Yes.
Are you smoking it, or are you?
I think it's mostly in pill form.
Mostly in
I
pill
don't
form.
believe that it's.
All right, Mindy?
We do have a couple of questions. One is from Greg. He said, are there medications that we should be more worried about than others?
So I would say opiates and benzodiazepines, and those are just big drug classes, so it's hard for me to list all of the medications that come underneath those drug classes, but that's where you seek anytime any prescriber gives you anything, you should be asking what it is.
Right.
And you should be asking them, is there any risk for me? And I think that's the same thing when you want to go in with your physician. You should let them know if there's something that's sensitive, something we touched on earlier. If you're worried about your information being protected, one of the first things you should say is, I want to talk to you about something, and I want you to protect my information. And let them know that if they can't protect that information from you, then you're not going to share anymore. But most of the time, they'll say, okay. And maybe they have a way of protecting the information so you feel good about it. But so back to the question, benzos and opiates are things that really have a tendency to cause you to want more of them. So, and what happens is if you take them over several days, and it's usually not just one pill for a week, but if you take it multiple times a day for a couple weeks at a time, you're going to change your body's chemistry, and you're going to change the cells, the actual cell structure, and your body is going to start requiring that medication. So those are the two drug groups that you really need to worry about the most.
So you said
benzodiazepines. So that would be like a Xanax, Klonopin, drugs that we usually use to treat for anxiety.
And opiates.
And
either
opiates.
One. Okay. Someone's asking, what if someone is allergic to lidocaine other than opioids? What medications can help manage pain effectively?
So there's lots of different things. I mean, starting with I think I mentioned Tylenol. This would be about my fourth time. Tylenol is a great place to start. Usually pretty safe. Unless you have any type of liver issues going on, Tylenol is a great choice. And then, of course, there's Motrin.
What's the difference between these? Because
So Tylenol is acetaminophen.
Right.
It's its own drug. There's no other drug that's like it.
Gotcha.
Motrin is in a drug class called nonsteroidal anti-inflammatories. So it helps to decrease inflammation, but it's not a steroid, but it acts like a steroid. So they're different.
So Tylenol doesn't really do anything with inflammation.
It does help a little bit. It really doesn't help quite as much as a nonsteroidal does, but it does have that potential to help. It's great for headaches. It's great for fevers.
Right.
And Tylenol is cleared by your liver, where you have Motrin, or the NSAIDs are cleared by your kidneys.
Wow.
So, and the NSAIDs can cause some issues with blood pressure. So if any type of blood pressure issues, then the NSAID might cause a little more problem for you than taking Tylenol.
Gotcha.
Which is why generally we say take Tylenol first.
Right. That's why I couldn't remember which was which. Mindy.
We do have another question. This one's from Lauren. She said, what's the plan for treatment? Presently, the vast majority of MCOs do not authorize inpatient care for opioid dependence, as opioid detox is not physiologically life-threatening or medically necessary. Self-pay for IP care is not feasible for most users and their families.
First off, what does it cost? I'm curious, what, for someone who doesn't have insurance, what is it, an astronomical number?
I can't tell you for sure because I haven't been on that side of things. I'm going to guess it's a few $1,000s.
Okay.
Usually for inpatient, it's going to be more.
And so she's saying that the insurance doesn't cover it because it's not life-threatening?
She hit Lauren, right? Lauren hits on a great point. Lauren is letting us all know that our insurance is not doing a really good job at covering things. And in the state of Maryland, if you're looking for an inpatient facility, there are only a few. And the beds are often full. So through the state, one of our biggest issues in our emergency room is that we have patients that are coming in and they have psychiatric illness and they may have some drug issues that are combined with those, and we can't move them from our emergency room because we don't have a place to move them to. So one of the things we really need to do is try to beef up what is available for our patients. If you have Medicare, Medicare does not cover intensive outpatient therapy for most of your Medicare plans, and that's a real problem. So we don't think of our 65s and older as having drug issues, but we have a lot of what we call dual eligible. So somebody may be a disability. So of course, if you have disability, it's usually caused by some type of painful accident that you had or affliction that you may have. So when you have those patients really often are the patients that end up on too many opiate or benzos or a combination of the two, which is extremely dangerous. And that's one of the places that healthcare needs to move to.
Wow.
Great point.
That's a big problem. And Obamacare or whatever is not dealing with that. I mean, I don't know. I mean,
it gets you health insurance, but that doesn't mean it gets you every type of specialized program that's
Right.
out there.
Right.
And so by coming to GBMC's primary care, what we're trying to do is we use all the resources that we can,
Right.
looking at the type of coverage that you have and the affordability or how much money you can spend and get you into some type of program to make sure that you can get some type of assistance.
the real problem is for our society is that the addiction is then causing so many secondary problems, challenges, jobs, keeping your commitments to life and your family. If you have any other questions, we're talking about pain. This subject is very complicated because it can go in a lot of different directions.
At least you didn't say it was very painful.
Oh, no. Yeah, it's very painful. Question here, when I had shingles outbreak, my physician prescribed lidocaine, but my insurance company refused. They prescribed again one other time for my back lumbar degeneration, and even after fighting pain, no success. Oxycodone is the med I have that is covered by my insurance. I worry that people believe that this is the only thing that will ever manage their pain. I know there are complementary therapies, but some are limited by money and can't go to chiropractors, acupuncturists, yoga. What are the options in this type of experience?
So there are, besides just lidocaine and Percocet, there are oxycodone, there are lots of other options for pain management. Money is always going to be an issue. So we can try using the most effective, least expensive medications, and we just can move around. There are topical non-steroidal anti-inflammatories. They're not inexpensive. Then we have some non-steroidal anti-inflammatories that we can do prescription-wise that are generic and shouldn't cost you quite as much. And there's a large class of non-steroidal anti-inflammatories. And just because one doesn't work doesn't mean that we can't change from within that class itself to try something else. So there are a lot of medications. But going back to understanding that you may just have to live with a certain amount of pain. And how do we get ourselves mentally prepared for that? I know that my pain level on a 0 through 10 is often a 5. How do I get through the day with a 5? And there are days that then when it's going to be an 8 or a 9 or a 10. And that 8 or 9 or 10 requires a different type of treatment than the day when I'm a 5. So having you prepared for all those different scenarios, it's not just one size fits all for every day.
Right. It's complicated, and again, thank goodness for Tylenol, I guess. We could do an advertisement for Tylenol here. Mindy, any other questions coming in?
Right now.
So at this point, GBMC is my go-to hospital. I feel like your emergency room is probably overburdened, maybe with people that come in maybe sometimes that should not use the emergency room for their health care, but people are doing that. If you're someone who's in a life-threatening situation, obviously you've got to go to the ER. But you've talked about some of the things that you can do to try to alleviate the pain, to try to avoid. I mean, I feel like people are wondering, do I go to the hospital? Do I not? Do I see my doctor? Do I not? We're constantly in this balancing act of trying to decide whether or not we should treat the pain.
So when you have that question go through your head, that you should be calling your primary care physician because they're going to be the gauge for you where you go. And if you don't have a primary care physician, you go to gbmc.org, look up the website, find a doc, and we are accepting primary care patients at all of our sites, our 10 different sites across the GBMC Baltimore region. And I believe that we really have something special with our behavioral health integration, which also works for pain and substance use. So we're really working hard to be the best advocate we can for our patients. And, we want to protect you, we want to help you, and we want to help you make the right decisions about the right level of care that you need when you contact us.
Very good. And for anyone who's watching who is apprehensive to confide in the doctor, you've got to talk to an expert. I mean, basically, and you've got to trust them, and you've got to be able to say, hey, I'm going to deal with some sensitive issues with you, and I got to know that I've got your confidence, and that this is between us, and that you're going to help me as your patient. And that's a discussion I think that you can have with any doctor.
We're partners in this together.
Right. That's what it's all about. GBMC will be back very soon with another. I know you've got a number of hosts. I can't do them all. I love watching all the different episodes. I've learned so much, and this is a great Facebook page to follow. If you happen to just come across it today, or you're watching the replay, like the GBMC Facebook page, subscribe to it, follow it, share it with all your friends, share it with your family members, because there's information in here that other people might be able to use that you might not know they need, because we're dealing with some pretty sensitive topics. So thank you very much for watching today. Thanks for listening to 93.1 WPOC and iHeartRadio. Download your iHeartRadio app so you can listen. Have a great Thanksgiving. Hope everybody has a great Thanksgiving. You ready for turkey and pumpkin pie?
I'm ready for some turkey.
I know turkey takes away my pain. I think the L-tryptophan. I pass out on the couch and I don't feel a thing. Might have something to do with the bottle of wine too. We should talk about one question I did have really quickly. It's probably not a good habit to get into treating pain by drinking. That's masking the
we call that self-medicating.
Self-medicating.
Which, taking Tylenol is also self-medicating, but drinking alcohol to medicate is not where we want you to go, because that can create additional issues. You can end up with some medical problems as a result of that.
So cautiously enjoy a glass of wine for Thanksgiving along with your meal. And as we think about what we're thankful for this holiday season, I hope you enjoy a lot of blessings with your family and a wonderful holiday season. Thanks for watching.